Hi, my name is Steven, and then today I'll do a case study on 2009 H1N1 pandemic. So first step is we need to know the background. The H1N1 virus is a type of influenza virus that was initially detected in Mexico City around March 2009 at the start of the influenza season, although there are theories that said it may persist before that time and maybe just people haven't recognized yet. And also, this virus is a new virus because it is a unique genetic combination of swine and human influenza virus that has never seen before. And then it is proven to be transmitting human to human after confirmed cases without patients interacting with pigs. And then the symptoms of this virus is just normal similar symptoms to common flu, including fever, cough, sore throat, headache, and body aches. And that is also one of the reasons why it maybe goes undetected for a while. And then through epidemiological research, it is found that children and young people may be more susceptible to this virus. So the current situation, and then we did a SWOT analysis, which is strength, weakness, opportunities, and threat. So for the strength, the WHO has declared this a global pandemic, allowing cooperation between different countries. And then CDC in the United States is able to decode the genes of the H1N1 and allow free use of this information globally. And then the weaknesses are there are difficulties in verifying all cases of H1N1 to confirm the pace of spreading. This is because a lot of people are either asymptomatic or they do not realize they may get this new disease. And also, there are drug-resistant genes already found that around the world that may create difficulties in treatment. And then the opportunities are there will be innovative informational technology to be implemented to record all the suspected and confirmed cases of H1N1, including all the informal reports and the geographic distribution of cases. And then there's also opportunities to educate the public about how to properly manage personal hygiene to decrease the risk, which included washing hands and wearing a mask when you're sick. And then the threat is reducing the risk requires self-prophylactic measures and behavioral change, which could be costly and receive backlash from the public. Like forcing people to wear a mask in the public when they are sick is going to be hard because wearing a mask is not going to be comfortable. The step 3 is prioritize core issues. There is an estimated total cases of over 60 million, with most of the cases undiagnosed or asymptomatic. Expected death related to H1N1 is between 150,000 to 575,000, while only 18,000 deaths are confirmed by WHO or the medical facilities. And then H1N1 continued to be circulating around the globe during the influenza season after the pandemic, so even now during 2020. So we should prioritize surveillance to detect possible influenza outbreak around the globe and then genotype the strain of the virus so that we know what type of influenza virus we're tackling with. And also there's prioritized education for hygiene, such as wear masks when having a symptom or wash hands often during the influenza season. So there are also alternative measures that are very essential. One is one of the most essential one is to help countries on the globe to build capacity to handle such pandemics, especially for developing countries. So the one approach is to issue technical guidance on influenza prevention and controls. So CDCs from developed countries could provide guidelines for doctors in developing countries of how to deal with these influenza pandemics. And then another approach is to help build laboratories in developing countries that are able to perform these PCR tests to detect any new strains of influenza virus so that we could detect the outbreak first. And the following recommendations are education to the public about personal hygiene, including washing hands and wearing masks. Hospitals should have sufficient supply of essential antiviral drugs during the influenza season, including oseltamivir and zanamivir. And the third recommendation is the yearly influenza vaccine should be at the core of the public health campaign to help decrease the prevalence of different types of influenza. Vaccines have been proven to be useful to decrease the transmission risk of influenza. And finally, our action plan is by 2025, the public health department in every country around the world should be able to perform PCR tests to detect possible influenza outbreak. By 2030, more than 80% of the population around the world should have access to influenza vaccines, so there should be herd immunity every year for the influenza. And by 2030, hospitals in towns with population larger than 1,000 should have sufficient stockpiles of antiviral drugs that could treat possible patients. And by 2040, there should be a global surveillance system that allows researchers and clinicians around the world to access data about possible outbreaks. So, finally, in my own opinion, I'm very supportive of getting influenza vaccines, and I think they should be included in medical insurance or provided at a very low price. And also, I'm supportive of this because I'm infected with flu before, and these symptoms are nasty and not very comfortable. So, I guess nobody wants to get these.